An ailment is one too many, so we're bringing the health experts closer to you. Your health matters.
It is indeed. Your health matters. As I mentioned earlier on, in studio, we are joined by Dr. Claudine Hartell, and we are talking about amenorrhea. So she is in studio. Good morning and welcome to UFM.
Thank you so much, Pelo. Thank you for having me this morning. Excited to be here.
Thank you for taking the time to have this chat with us. What exactly is amenorrhea?
Right, so amenorrhea simply means the absence of your menstruation.
Okay.
So it generally happens if you've missed 3 or more cycles of your menstruation, or if a teenager comes to us, for example, 16, 17 years old, and she still hasn't seen her menstruation yet. And then that we classify as amenorrhea.
What are some of the most common, causes of amenorrhea?
So it all depends, There's 2 types of how we classify amenorrhea.
Yeah.
Okay, so there's primary amenorrhea. That means the teenager comes in, has never seen her period yet, generally from the age of 16 onward, nothing yet. And then secondary amenorrhea, meaning that they've seen their period before, but now it has disappeared. Okay, so it all depends on when the situation has happened, and then we can classify in terms of what are the possible causes for these. Okay.
Yeah, and how often do you actually come across this where you find that maybe a 16 to maybe even an 18-year-old has never seen, their periods?
It's not uncommon.
Okay.
Okay, so generally most girls do see their periods, but every now and then, occasionally, we do find the teenager that still hasn't come across their period by the age of 16. Yes.
Oh my goodness. Okay, so let's talk about the lifestyle, factors that could be, the possible contributors to, why it is that somebody has not seen their period.
Yes. So at the extremes of what we call normal, for example, the super athletes, okay, or the extremely obese, or the very, very underweight patients. Okay, so in those extremes, our bodies do go into a kind of a reserve state, okay, especially in the more eating disorder kind of states, okay, but then on the other side of the spectrum with the severely obese patients, and then that's another mechanism of why our bodies are just not ovulating. Yeah.
Okay. All right. And what can we do to kind of prevent this amenorrhea from actually, occurring in our lives? I can only imagine an 18-year-old, not having, seen their periods, and now you're about to matriculate, and the pressure that also comes with that.
Yes.
It could be quite, an issue, I suppose, an emotional issue as well. Can we just talk about how to prevent amenorrhea?
Yes. So in terms of prevention, there's not much one can actually do, but more in terms of rather to come seek gynecological care sooner rather than later and waiting for it to progress for a long time. So for our teenagers, it all depends. So from the age of 16, definitely they must come see us. Okay. So and it all depends on have they formed other sexual characteristics, for example, breast development, pubic hair development. Okay, and then we can see, okay, what are the possible causes for these? And then depending on the cause, we treat that. Okay, so there's nothing that they can do to prevent that. They just need to come see us sooner. In terms of the other patients with secondary amenorrhea, where they have had their period, now 3 cycles have passed, no period. They did have their cycles before. So that group of patients must also come see us, because it can be different factors causing this.
Yeah.
Okay. For example, hormonal imbalances. Those are the things that we have to look at. Okay. For example, structural abnormalities. Those are the structural in terms of, are your ovaries still fine? Is your womb still fine?
Yeah.
Okay, so those are the 2 groups of patients that we have to evaluate what's going on. So unfortunately, nothing that you can do to prevent, but definitely to seek more urgent medical attention, because it's not normal not to have a period.
Is it genetic as well?
Yes.
Something that you can inherit from your parents?
Oh no, not in that, not in that manner.
All right.
But certain genetic disorders, for example, Turner syndrome. Okay, for those patients, their gonads or the ovaries don't develop well. Okay, so they also present with, we call it primary amenorrhea. Generally, they don't see their period, and they present to us in their teens, late teens. Yes.
And what are the tests that are conducted to, kind of determine the cause of this amenorrhea?
So it depends on what other symptoms are presented with them.
Mm-hmm.
For example, the primary symptom is just not seeing their period.
Yeah.
So for the teenagers and for the patients that are not teens anymore, we first need to make sure that they're not pregnant, because pregnancy in itself, as much as what we want to overlook it, it's one of the main causes of not having a period.
Yeah.
Okay. So then for the teenagers, it all depends on have they developed breasts and other secondary sexual characteristics. And then we will also look then at the hormones. It's a hormone secreted in your brain that works on your ovaries. Okay, and the ovaries then send signals back to the brain.
Yeah.
So those are the hormones that we check. And then we also check whether their womb has formed, because in certain conditions they are born without the ovaries forming, or born without the womb forming, or perhaps it has formed but there's an obstruction or like a blockage, and then they are having a menstruation but it's just not coming up because of this blockage. Okay, so those are the tests in that group of women. And now we look at the other patients. We ask about what else they have. For example, are they very, do they pick up weight easily? Are they very hairy, especially facial hair? Are they prone to acne? Okay, those patients, we also do certain hormonal studies and also look for a condition called polycystic ovarian syndrome, because that's quite common, a common cause for having secondary amenorrhea. And then of course certain medications, especially your antipsychotics, can also cause your period to go away. Okay, so and also then if our patients have premature ovarian insufficiency, that means before the age of 40 that their period also goes away. So it all depends on where in the patient's life they are, what other symptoms they have, and that will direct the kind of tests that we do. Okay.
And because I'm thinking as a teenager, if you've never seen your periods before, you won't miss them, right? You won't miss them. So if they go now untreated, what are some of the health implications thereof?
So depending again on the cause, okay, but estrogen is really important for us women, for our cardiovascular health, for our mental health, okay, for childbearing, fertility related issues. So in a patient that hasn't had their period yet in their teen years, we need to make sure, especially their reproductive health, if they were able to bear children, if they would like to, and even if they would not like to, it's too early to determine, I think, at that stage for a teenager. But even if they don't, we need to make sure what is going on in terms of what kind of organs they have in their pelvis, has it formed or not, or are there other types of organs there?
And we are talking about amenorrhea. I hope I got that right. I just wanted us, because you touched on it before we actually took a little bit of a break, I want us to talk about, whether amenorrhea can actually affect fertility, and are there maybe any treatment options?
Yes, definitely. It does affect fertility. So with regards to fertility, one needs to have regular cycles. A regular cycle means that every month your body has made an egg, the egg has ovulated, and either conception takes place or it doesn't take place. So if you don't have a period every month, it means that every month you're not releasing an egg. And if an egg is not released every month, there's nothing to fertilize. Okay, so with regards to those situations, we have to determine what is the cause for our patients not to ovulate. Most common cause is polycystic ovarian syndrome, okay, where our patients don't make or release an egg every single month. Okay, we also have our other patients, at our older patients, inverted commas, because they're not really old, but from the age of 35 onward, we do find that our genetic material in our eggs decrease, or it ages.
Okay.
Inverted commas. Okay. And in those situations as well, our patients find it much more difficult to conceive. But in that group, they might still have a period every single month. It's just the quality of the egg has changed now. Okay. But regarding amenorrhea and fertility, so if it's related to polycystic ovarian syndrome, where they don't release an egg every month, and then we start our patients on treatment, okay, it's a certain type of tablet that they have to take at a certain time of their period so that their body makes an egg. And we monitor them quite closely because this kind of treatment can let them make multiple eggs, like 2, 3, or 4 eggs at a time. So we do
and
warn
that's
them
where the
multiple
triplets
that's
come
it.
through now.
That's
Oh my
it.
goodness.
That's it. So there definitely is treatment for those patients. But then again, like I said, depending on where they are in their fertility journey and depending on their age, we might then do other forms of treatment where we give them medication to make an egg, but we would rather advise them, you know what, let's rather go for IVF, instead of giving the medication at certain times of their period.
Yeah.
Yes.
And just in closing, what kind of words maybe of wisdom from a doctor like yourself, to somebody who maybe has seen their periods, but their periods has ceased and now they're panicking, and they just wonder they're not pregnant, they've done all of those tests, how can you what can you say to kind of give them a little bit of comfort?
Yes. So luckily we do have a lot of treatment available. Okay, treatment in the form of estrogen, because that is the female hormone that lets all this magic happen.
Yeah.
Okay, so not to fear, because we can manage it. I always tell my patients the best thing is that we can still manage it. The worst thing we can tell a patient as a doctor is, sorry, we can't do anything about that. So we are not there at all regarding amenorrhea.
Perfect.
So we first need to find out what the cause is. Sometimes it can be something like a thyroid disorder, that we treat very easily, or a prolactin disorder. Prolactin is a gland in the brain, okay, that can sometimes overgrow and cause excess hormones to be released, and that can be treated easily. Okay. So there are treatment options available for them, but please not to wait too long. Okay, because waiting too long can have detrimental effects. Yes.
Thank you so much for having this conversation. Don't wait too long. There's nothing to fear. For as long as the doctor can do something about it, then something will be done. Thank you so much. That is, of course, our conversation just concluded with Dr. Claudine Hartell, and we've just spoken about amenorrhea, which is the ceasing of your periods, right? Thank you so much, and enjoy the rest of your day.
Thank you so much for having me.